Over.
Congressman Tom Price is a Republican from Georgia. He is also a doctor, and he is also the chairman of the Republican Policy Committee. Congressman Price, good morning to you.
Hey, Brooke. Good to be with you. Thank you.
Let's talk about the public. Do you think the public is ready to move on? I mean, I'm sure you've gotten many a letter, many an email from your constituents since Thursday. What are they telling you?
Well, they're saying that just what they were saying on Wednesday, and that is that they think this law is the wrong direction. So regardless of its constitutionality, it's the wrong policy for the country. And as a physician, I know that they believe that because they're concerned about the relationship that they have with their physician. This doesn't work for patients or doctors. Doesn't work for employers. Already small businesses are saying they're not going to be able to hire because of this law. Doesn't work for states. You got a lot of states that are opting out. And then it clearly doesn't work for the federal government from a financial standpoint. So what we need to do is to repeal the law and then move in a positive direction, a patient-centered direction that gets folks covered, solves the insurance challenges, and we can save hundreds of billions of dollars in the system, all without putting Washington in charge.
Let me jump back to what you're saying, that Americans, you're hearing from them, they say we're going in the wrong direction. I just want to point you to this new Gallup poll because it appears that the approval numbers are actually up. So according to this Gallup poll, 46% agree with the Supreme Court's decision, 46% don't. More interestingly, among independents, 45% now agree, 42% disagree. And as I mentioned, those approval numbers are up since Thursday. Do those numbers, sir, do they suggest that the public is in fact ready to move on from this?
Well, I think what the American people will say is if the Supreme Court rules that it's constitutional, then it's constitutional. But again, the fact that it's constitutional doesn't mean it's the right policy for the country. I had a conference call last night with doctors from around the country who are so terribly concerned about this law because they know that it will limit their ability to care for their patients. That's the bottom line. If doctors aren't able to provide the kind of care that they've been trained and through their experience give to their patients, then this is the wrong law. Okay. And that's exactly what we believe will occur, and that's exactly what the doctors of this land understand.
Well, let's get to that R word that we have been hearing from many Republicans, repeal. I know your House leadership heading to this vote to repeal July 11th, but, it really is strictly symbolic. You don't have a majority in the Senate. You don't have a Republican sitting in the White House. Here's what Congressman Phil Gingrey actually told us just this past Friday. Take a listen.
Number one issue now, as we go forward over these next 4 months, repeal Obama. Because once we do that, then indeed, if we have a majority in the Senate, we maintain that majority in the House of Representatives, and we have the 45th President of the United States, Mitt Romney, then we can indeed repeal this bill, and we can do it by reconciliation, since it's a tax issue now, as Justice Roberts has redefined the law.
So let's say you and your Republican colleagues, you get your way, you repeal this law. As a doctor, there are multiple parts of this law that people really like, including, you mentioned this a moment ago, pre-existing conditions, coverage for that, allowing kids to stay on their parents' insurance, and reducing Medicare, the donut hole for prescription drugs. So how do you then, Congressman, you repeal the law, yet you keep the parts that people like? How do you do that?
Well, again, there are wonderful solutions. First, you've got to repeal it because the premise for the president's law, the current law of the land, is that Washington knows best about your health care. And again, that's harming the ability for physicians to treat patients. It's also harming the ability for small businesses to hire out there. So it's not just bad for health care, it's bad for the economy. Now, the proposals that we put on the table will get virtually every single American covered, but covered with the kind of health coverage insurance that they want for themselves and for their family, not that the government wants for them. And then portability and pre-existing are relatively easy to solve without putting Washington in charge. You simply allow individuals to own their coverage regardless of who's paying for it, so it goes with them if they change their job or they lose their job.
But how do you maintain that with regard to the pre-existing conditions? I mean, you have to have healthy folks paying those premiums so that those people with the pre-existing conditions are in fact covered. How do you do that?
Brooke, if you look at who's troubled by the problem of pre-existing illnesses and injuries, it's folks in the individual and small group market. It's not folks in the large group market. So the easiest way to solve that is with robust pooling mechanisms for all of those millions of Americans in the individual and small group market so they can pool together, get the purchasing power of millions. When you do that, what you do is make it so that every single American can have the kind of health coverage that they want for themselves and for their family, not that the government wants for them. And that's a critical distinction.
I just want want to get to this question because it's really, we were all fascinated, some people surprised, the role of Chief Justice John Roberts in this whole decision last week. So I just want to read parts of two op-eds this morning that really jumped out at us. This is from the Washington Post. Fred Hyatt says this, and I'm quoting him: Chief Justice John Roberts last week did something that in polarized Washington may turn out to be more important than saving Obamacare. He showed that compromise can be consistent with principle. And one more, this is Wall Street Journal. This is how Roberts' decision is being read by politicos. Quote, the Chief Justice is a genius. All of a sudden, he is a chess master, a statesman, a Burkean minimalist, a battle loser, but war winner, a Daniel Webster for our times. Now that we've had more time to take in Chief Justice Roberts' reasoning, we have a better summary: politician. Congressman Price, which is it? Politician or a symbol of bipartisanship?
Well, I think historians will probably be able to answer that better than I. What I will tell you is that I think what the court did...
If I may, which is it to you, in your opinion?
Well, I think the Chief Justice was wrong on this, but that's not for me to say. The court has ruled, and I respect that ruling. But I think what the Chief Justice says, look, in fact, he said it himself. He said it's not the role of the court to protect the citizens from their political decisions, the consequences of their political decisions. He threw it right back in the American people's lap, and appropriately so. This is a policy decision. Whether or not it's constitutional, it's been now ruled constitutional, doesn't mean it's the right policy for the country, which means now we've got to go to the people and say, do you want Washington involved in your lives in this manner, or do you believe that there's a better way? We believe there's a better way.
So you won't give me whether he's a politician or a man of bipartisanship. You won't give it to me.
Well, I don't think that's the role of the court. The role of the court is to determine whether or not a law is constitutional. The court said it's constitutional. It remains the wrong policy for the country, which is why we believe that through appropriate political processes, the American people will select a Congress and a president that will put in place patient-centered solutions, not Washington-centered solutions.
We will see how the history books write about Chief Justice John Roberts. Congressman Price, appreciate you being on. Thank you.
Thanks, Brooke.
Still to come this morning on Starting Point: sugar and spice and everything nice, except when they tweet. Parents